Well, hello, everybody, and welcome to this episode of the podcast show. This is the last recording of 2021 from me here in BC. My dogs are behind me. And today, my very special guest is Dr. Richard Nahas. So, Richard, do you want to introduce yourself and tell us a little bit about you and your journey to this point and on the helping people with pain?
Talk about myself. What an interesting challenge. Well, when I applied to medical school, I had to write an essay about why I wanted to be a doctor. And I still remember that the way it started was that if all of society disappeared and we didn't have buildings and we didn't have universities and we didn't have corporations, we would still need healers. And I want to put my abilities and my service to something that means something. And, you know, I've always been interested in science and I've been fascinated by the human body, and I'm still sometimes in awe of, you know, the mysteries of the human body. But at the end of the day, it just feels good to help people. So my career started at the University of Toronto, and I was an ER physician because that felt to me like the most tangible way that medicine can solve a person's problems. I did that for about 4 years. And in 2003, SARS came to Toronto. It was the first coronavirus.
Yes.
And I was working at 2 emergency departments. And oddly enough, they were both closed because they were contaminated. And I ended up taking a job working for public health, treating people who were hospitalized with SARS. I was wearing a spacesuit. The CDC was there. It was 6 months, quite grueling, quite memorable. But at the end of it, we learned that the odds of dying of SARS were twice as high if you were diabetic, much the same as as COVID. And I was struck by the fact that we have all of this technology and effort that's designed to try to keep people alive and prevent them from dying of SARS, but we really don't do much to address the health that makes people vulnerable. And so that was a light bulb moment for me. And I needed a break. I had been in school basically my whole life, and I had always wanted to see the world. So I packed up all my stuff. I told the ERs to not expect me back for a while. And I bought a ticket to Brazil and I went surfing with a friend. And when I was in Rio de Janeiro, or Rio de Janeiro as they call it there, I stumbled into a fruit and vegetable market and saw these old ladies from the villages selling herbs and plants, and started talking to them just to practice my Portuguese. And I learned some names that I went to an internet cafe and started Googling and learned that there's actually science behind some of these things that I'd never heard of. And that was the first of many experiences on what turned into a self-directed sabbatical. So I spent about 2 years hanging out with traditional healers from many cultures and came back to Ottawa, where I'm from here in Canada, and set up a practice in integrative medicine. And I've been doing that for 15 years now, mostly with a focus on chronic pain management. I do nerve blocks, trigger point injections that I bill to the healthcare system. I prescribe medications when appropriate, and order MRIs and refer to surgeons. But I also administer acupuncture and release restrictions in fascia with my hands during the visit. We take patients through breathing exercises and focus their attention on what they're feeling using mindfulness exercises. So we turn the procedure into a meditation. And to the best of my ability with people who are on a limited income, I just use whatever tools I can identify for them to reduce their suffering and help them live more functional, meaningful lives.
Amazing.
Yeah, and over the years, I've been quite involved in academic medicine in many ways. I had started my practice because I really believe that integrative medicine can improve healthcare. And so I published some papers and was involved in some studies and taught some courses to undergraduate medical students, and became really mindful of the many ways that I could focus my career. And then I stumbled into something that changed my life forever, so to speak. Once again, it was the next chapter in my life. When I recognized this hugely important concept, which, without sounding like P.T. Barnum, could change everything in medicine. This idea that every physical or mental, emotional injury that has ever happened to you leaves a scar. It alters your nervous system. And in the case of physical injuries, as well as emotional injuries, it also changes your tissues. And these scars that you have are like the map of your unique body. And although in medicine, if you have a shoulder problem, the finest orthopedic surgeon in the world will never inquire about the broken finger that you sustained while playing basketball, and think that that might be somehow related to the shoulder. Every other healing tradition in the world targets their efforts to blockages, to these areas where you're wounded. So the blockage theory of disease is this idea that I'm still in the early stages of working on developing for our profession and for a broader audience, because I'm aware that you can't just spring this idea on people and expect them to adopt it unless you have data and a lot of theoretical support. But certainly I treat blockages every day in my patients, and I think I'm allowed to say that I achieve outcomes that none of my colleagues do. So I'm really interested in sharing this idea, because traditional Chinese medicine 5,000 years ago talks about blockages that disrupt the flow of qi.
Yes.
And tying that to connective tissue anatomy and fascia, very science-based.
Yes.
And there's an explanation there that medicine needs to hear.
So let's talk about that, because to be honest, that's been my journey as well. Chest pain as a 20-year-old, went from competitive swimming, national level, and couldn't run as a teenager. So I went through 7 years of chest pain, and I didn't know what it was, and the tests were all negative from my family doctor. Then eventually it was released. It was a fascial release massage sessions that cured it. Never came back, ever. And that was 25 years ago. So let's talk about that a little bit, because I've now also I've developed fascial approaches, fascial concepts, energy appreciation within the fascia. I see it all the time, just like you. So let's go back. How does the trauma, as you mentioned, let's describe what is trauma? Like, is this like sexual abuse? Is it more than just abuse or neglect? Like, these are big things that we all know is traumatic, but what is trauma for a person?
Well, I think the broadest definition of trauma is anything that leaves a mark in your nervous system.
Right.
In your brain, essentially.
Yeah.
And so if you injure your hand, the nerves in your hand are a little bit sensitive
Yes.
for life. And if you've been assaulted by someone when a specific Beatles song was playing,
Yes.
every time you hear that Beatles song, that memory, that short circuit in your nervous system will be activated.
Mm-hmm.
And our traumas shape our personality in so many ways. They shape the things we desire
Mm-hmm.
and the things that we have aversion to. They define our personality in many ways. Of course, we're also products of genetics and culture and family and love and positive experiences, anything that leaves a mark. But physical injuries affect the nerves in the area. They affect the tissues in the area. But because the nerves are part of a network, which is a whole person unified network, if you have particularly problematic scars, if you have a surgical wound that got infected, or if you have a dog bite that you sustained when the dog terrified you,
Yes.
those marks may be deeper.
Mm-hmm. Emotional connection with the physical trauma.
Correct. Because your brain does not distinguish between physical stress and emotional stress. They're both just electrical noise in the brain. They're both disturbed wires. So my work has really been focused on creating awareness about how these are really fundamentally important to the endeavor of human healing. And it's been a really interesting path because I have blockages too. I've sustained a number of physical injuries. I've had my share of emotional traumas throughout life, and understanding myself has allowed me to experience things and feel connections in the body that I never would have been able to appreciate in others. So it's been kind of this physician heal thyself kind of journey.
I laugh because when I left Scotland, or my last exam ever in Scotland was in in the year 2000. And the last paper, the last question was discuss, physician heal thyself. I think they said Mark Twain, but it's a biblical statement. And I've spent 20 years kind of reflecting on that statement. And it's so true, isn't it? Like, we are the physician within. All the healing is within us. It's encoded in our DNA. We're programmed for it. It's easy to say if we cut ourselves or we break a bone. But when you look at the emotional scars, the mental scars, the neurological scars, and I love that terming that you've got about blockages and in scarring, because it just sets us up with a real image of, that event when I was 5, when I was at school, and the teacher said this to me, or that, or whatever it may be, is literally just vibrating in our essence, in our nervous system, in our memory system, and we're brought back to it time and time again if we get triggered. So I'd like to ask you, what is the fascial component connection in your experience?
Well, I don't know if you dissected a cadaver when you went to medical school. In some cases, they don't do that anymore. When you were dissecting your cadaver, the connective tissue was just the wrapping paper at Christmas morning, right? It's what you cut away to get to the stuff you want to look at.
Yeah.
And we still think of connective tissue as nothing more than connective tissue.
Mm-hmm.
But in fact, if you flip the paradigm around and you recognize that all of these specialized structures that we have, the bones, the muscles, the ligaments, the tendons, the organs, the glands,
Yes.
they're all specialized structures that grow from connective tissue. And it doesn't just hold them together biomechanically. It also serves a role that I think medicine has overlooked. And it's essentially part of the nervous system. Mm-hmm. So the most ubiquitous molecule in the connective tissue system is type 1 collagen. And if you remember back to your undergraduate biochemistry, collagen is it's a repeating set of 3 different amino acids. And it's sort of like ABC, ABC, ABC. And the structure of collagen is woven into a crystalline form. Mm. And in fact, in the 1950s, Japanese researchers confirmed beyond a shadow of a doubt that collagen is piezoelectric. So that means that in the same way that quartz is piezoelectric, which is why you have quartz in your watch, why quartz is in technology and radar. Much of the quartz in the world was originally mined to build technology for World War I and World War II, because piezoelectric substances vibrate in the presence of electricity. Mm. And so it is an undeniable fact. It's a physical truth that the collagen in your tissues is vibrating because it is in the presence of the electricity produced by your heart, your brain, your nervous system. And the vibration of collagen is one aspect of what the Chinese call qi.
Yeah.
And it just so happens that all of these modern manual therapy experts who teach myofascial release techniques, they all recognize that anatomy is not a bunch of parts that function separately. It's long chains of fascia that hold structures together, so that when you flex your bicep, you're also engaging your forearm, your fingers, your neck, your ipsilateral shoulder. Everything is involved in every movement. And these long strips of fascia very closely correlate to the acupuncture channels of the body.
Yeah.
And if you think of connective tissue as just long guitar strings that are vibrating, and you think of fascial sheaths as insulators that separate one chain of fascia from another, you can appreciate that the flow of qi is nothing more than vibrations traveling along the path of least resistance in the body. So that's how fascia and the nervous system are just 2 sides of the same coin. And I haven't done any fundamental research to validate this concept in a way that I could share with a peer-reviewed audience. But certainly this informs all the work that I do every day. And I'm very fortunate to work in a living laboratory where I'm able to inject something and see what happens to a person within 5 seconds. And so I'm able to release a shoulder by injecting a finger or a tooth on the same side. And I'm time and again challenged to try to understand what I'm seeing and build a system of thinking around what I see.
Mm-hmm. Mm-hmm.
And it seems to fit with what all of these spiritual traditions have been saying for centuries. So if you have an appendix that needs to be removed, you have a small incision in your abdomen on the skin. You also have a small incision in the peritoneum, and then a very small incision where the appendix is resected from the colon. And we know from the basic science of wound healing that when wounds have completely healed, they have about 80% of the tensile strength that they had before the injury took place. And we know that even years later, an area that's wounded goes from having connective tissue fibers that look like this under the microscope to fibers that look like this, sort of knotted up and scarred, but they're kind of doing the job.
Mm.
These phases of wound healing where you first lay down the scaffold, then you build the connective tissue rough and quick, and then you remodel the wound to try to smooth it out, but it's never as it was.
Mm.
So you always have these knots in connective tissue that act as physical barriers to the flow of vibration in an otherwise continuous tissue. And in the same areas, we know that there's lots of studies that validate this, that there's a change in the way the sympathetic fibers in the area behave. Slightly more vasoconstriction, slightly impaired lymphatic drainage. These are technical terms, but for a lay audience, the nerves in every scar you have are just a little bit sensitive. And for some people, that may mean that you can tell when it's going to rain because your bad knee acts up a day before. But even if you're not aware of it, the sum total of all of these injuries, in addition to creating a local blockage, it adds to the total load that your nervous system has to carry, because there's a little bit of stress in all of those places. They have a slightly lower threshold for triggering a stress response. And so when you see someone with chronic pain and their story is that they bent over to pick up a piece of paper and they threw out their back, and it makes no sense that that could cause a lifelong debilitating injury. But if you see that person as a sensitized patient who's got restrictions all the way to up and down the chain, it breaks my heart to think of how many people have had to suffer for 30 years because no one was able to take care of that problem on day 2. So that's the sort of the essence of my work as it relates to chronic pain. The notion that there are these hugely important lesions that no one ever addresses in medicine. You can see your GP and then he'll refer you to a specialist and he'll refer you to another and you can get a second opinion. You can fly to the Mayo Clinic. You can, we've all read the same books. We all follow the same evidence-based medicine guidelines, but this is sort of equivalent to not understanding the existence of germs.
I agree completely. This what you're describing is my world as well. Every single patient is fascial issues with their pain, and I love the comparison to the germs. It's so true. 100 years plus ago, we didn't know anything about germs, and now we know a few things about germs. Maybe too much, maybe not enough.
Well, let's hope that viruses are the final frontier. We're learning finally how to tackle viruses. Let's hope we get there.
Yes, and that role of inflammation, as you mentioned at the beginning with diabetes and the you know, the inflammatory response that's in the body when people have got these comorbid conditions like diabetes or stroke or heart disease or any neurological problem. In fact, any chronic disease is inflammatory, you could almost say. And that ties back to pain as well, because pain is an inflammatory condition at the end of the day. Let's talk a little bit about your Seeker's method. What is that?
So the Seeker's method is something that was developed over many years in an effort to really simplify and distill this world of possibilities in terms of how to treat blockages into a very easy to learn technique. And it's something I'm now aware has to be really taught using hands-on demonstration to make sure that people can feel it. Mm. And so I've developed some content online to try to teach people about blockages and show them how to find and release their own blockages. Mm. And we're now just deploying like a physiotherapy clinic in my practice so that we can deliver 12 sessions in a structured intervention. A couple times a week, you spend an hour with a trainer who can show you how to find and release your own blockages. And we're hoping to measure outcomes at the end of those 12 sessions and demonstrate that it's very effective and teachable and safe. So essentially, it's an assisted stretching technique. Mm-hmm. Let's say you begin with a shoulder. It's a process for focusing your attention on touch. And when you do it to yourself, you begin at the sternum, because essentially your arm is held to your thoracic cage, and it's attached through the pec at the front of the sternum. Mm-hmm. Pec and clavicle comes out, and you travel all the way along until you find a spot that just feels a little different. I love that you're willing to dive in and go
there. Let's do it. Absolutely.
So for me, it's here right now. Only you know where it is for you, but I think you're in the right vicinity there, around the pec attachment to the humerus. Move up a little bit lower, right around here.
Yeah, I felt something there, a little bit unusual.
So when you find this point, this is what I call the point of maximal tension. This is where you have a knot.
Yeah, for sure. Yeah.
And essentially, when you have a trainer, they can provide resistance. They can show you some exercises. They can show you how to do it in a door wall.
Yeah.
Or use any adaptive tool you want. But the movement is to take a deep breath in while you increase tension. So in the case of all of these channels on the front of the arm, you increase tension by moving this way. All of the channels on the back of the arm, you increase tension by moving this way.
Okay.
Yeah. And so breathe in and use the other hand to provide some resistance. So, and focus attention on that spot. When you've created tension by tightening the spring, you can exhale and allow yourself to feel release. And release feels like a tingling sensation, a looseness. In some cases, there's a lightheadedness. And some people are better at it on day one than others. Mm-hmm. Some people really can't get out of their heads. They're like, am I doing it right? No, this can't be working. Maybe it's here, maybe it's there. Mm-hmm. They second guess themselves. But when I work with athletes or musicians or artists,
Yes.
or people who just have a lot of kinesthetic awareness. I can hold their hands with my hand, and I can guide their hands to the right spot.
Yeah.
And I can help them feel the first movement. And by the end of 5 minutes, there's like a show and tell that has created an experience for them that they can't walk away from, because all of a sudden, he's right. It's there. And when I speak to physicians and they feel it, when I did a 2-month break from my practice a year ago, I hired 2 doctors to look after my patients for me. And they each spent 2 or 3 days in my clinic and basically learned how to do it. And they were injecting trigger points that they could find by palpating restrictions in fascia.
Mm-hmm.
And they had a blast, and the patients loved it, and it was excellent. And again, this is myofascial therapy. This is not necessarily experimental.
No.
In the right hands, when you're mindful of where all of the important parts are, these are very safe to administer.
Mm-hmm.
If you're a physician, you can inject blockages. If you're an acupuncturist, you can needle blockages. If you're a manual therapist, you can use your hands to release blockages.
Mm-hmm.
And if you're a person who is looking for a self-care practice,
Mm-hmm.
if you're already doing yoga or Tai Chi, or you're already going to the gym, you can keep doing what you're already doing, but just touching specific areas. It's an act that radically transforms your nervous system. Because as soon as you touch something, you have tuned your awareness to that thing. And this combination of movement and touch, breath and awareness, I'm really looking forward to sharing with as many people as I can, because I think it's powerful on a personal level.
Yeah.
And I'm hopeful that with the time I have left, I can get close to making blockages a part of routine medical practice.
Phenomenal. Well, I hope everybody who's listening to this really appreciates what you're sharing here. I love that you've tied in that body awareness through touch, and then the fascia, and then the moving into it with an inhale, which increases tension, and then you're not mentioning the exhale, which helps to release it, which is interesting.
Absolutely.
You're kind of the opposite when you go back to the square one. But then that kinesthetic body awareness, somatic type awareness, and then it's changed. It's absolutely brilliant. So congratulations for figuring this stuff out and coming up with simple ways. And I'm sure you're going to be, getting this out here online for people to do with videos and things like that. If you're not doing it already, I'm sure you'll be doing it in the future. But no, it's important to be bringing this into evidence-based and to get some results. And I look forward to talking to you more about this, because I'm fascinated. I've got a very sore neck as I sit here around my C7. And I'm going to, after this little chit chat, I'm going to do this exercise. I'm going to ask you some tips. I've had it for about a month with all the stress of me moving countries in the next few days. But listen, Richard, it's been really good to get you on and invite you back again next year sometime to talk more about what you're up to, because we need to get this message of fascia out there and how it can be simply done and incorporated into other modalities. It's not rocket science once you're trained to implement some of this stuff. But we need leaders like you to increase this awareness globally, because if we don't do it, nobody's going to do it, because it's not going to come from the regular MD world. So thank you so much for coming on. It's been great to meet you. Thanks for waiting for me, as I had to do some stuff before. And
Thank you for doing this great stuff you're doing, bringing important information to people who need it.
Yeah.
Bless you.
Thank you. Is there any sort of website or resources that you can send people to right now after this?
You can visit seekersmethod.com to learn more about the technique. We're still putting some finishing touches on about 4 hours worth of content that will soon be available on an online platform.
Mm-hmm.
Hoping to make that available for free for people.
Wow.
And then offer some additional video content on an ongoing basis to support people who have done the original 12 sessions. They understand where their blockages are. They've worked with someone to develop the basic technique, and then they want coaching and support to help them implement it in their daily lives, because we all know that it only works if you use it. And often we just need a little bit of support to make it a part of what we do.
Mm-hmm. Mm-hmm.
So seekersmethod.com is the website for the technique. And my clinic is in Ottawa at seekerscenter.com.
Mm-hmm.
I'm currently pretty backed up, so I'm not taking new referrals myself, but we're hoping to have a team of rehab providers who can help people release their restrictions one-on-one in a meaningful way.
Well, all the very best to you and your career and achieving your goals here. Marvelous to talk to you.
Thank you, man.